Good afternoon, good evening. Welcome to today's webinar. We are going to discuss modernizing home care, a pathway to prevention. My name is Dr. Joy Voigt-Holmes. So before we get started, I just want to go over some disclosures and disclaimers. All listeners should apply their own professional judgment and experience with respect to all of the information provided. I do disclose that I represent Voco Polton LM as a key opinion leader and consultant. And I do want to thank Voco and the Dental Herb Company for their generous contributions so that I can deliver this content to you this evening. A little bit about myself. I am a dental hygienist. I graduated from Howard University School of Dentistry with a certificate in dental hygiene. I completed my bachelor's degree at the University of Maryland, Baltimore School of Dentistry, and received advanced degrees, my Master's of Health Science and Doctor of Health Science from Nova Southeastern University. I currently own my own company, Dr. Joy RDH, and I am co-founder of Gel Ed, which is an educational consultant company designed to bridge the gap between education and the educator. I am on the editorial review board for Inside Dental Hygiene, clinical advisory board for VTAL, and I hold several positions with different boards. So what are we going to talk about tonight? At the end of this presentation, I want you to be able to examine the connection between oral health, general health, and health-related quality of life. I want you to be able to explain how to incorporate the P4 model in dentistry to help accurately predict and prevent dental disease. I hope that you're able to describe emerging trends and products in the armamentarium used for oral home care that really focuses on biofilm control and the support of improved oral health. And then to be able to develop an evidence-based, personalized oral home care program with instructions for patients that promote both oral and systemic health. So it is really important that we have a solid understanding of oral health and oral health statistics. It's vital that we do this as practitioners, especially when we're developing home care plans with the proper oral health aides. But also we need to be aware of these statistics because we need to be able to stay within a budget. So what do we need to know? I don't think that we really pay attention to how much of a silent epidemic oral health is. And these are just some quotes. Oral disease has become a silent epidemic. This was quoted from the US Department of Health and Human Services back in 2000. And what it says is, it is among the nation's most vulnerable, poor children, older adults, and racial and ethnic minority groups. There are profound and consequential disparities within these populations. And we do know that there's a correlation between oral health and socioeconomic status. So the first time any official agency in the United States addressed the state of oral health of America was about 20 years ago. And this was done in the Oral Health in America report, a report of the Surgeon General. And this report was developed to bring awareness of oral health and its importance to the general health and well-being of the nation. So in 2003, shortly thereafter, there was a response issued to this report, and I apologize if the image is a little blurry. But the response to this report was called a National Call to Action, and it was designed to promote oral health. It was developed for professional organizations and individuals who were concerned with the health of their fellow Americans. So the response was issued to promote oral health and prevent disease, to improve quality of life, but also to eliminate oral health disparities. So some of the highlights of this report is that they wanted to change perceptions of oral health. It's really important that we change the perceptions of oral health, especially with our patients. That is how we're going to be more effective with the home care plans that we're developing with them. It's important that Americans believe that their oral health is not separate from their general well-being. The report also highlighted the importance of improving the health literacy of the public. Oral health literacy is going to be key. The report also highlighted the need to make sure that other health professionals were knowledgeable about oral health as well. The report wanted to make sure that it replicated effective programs and proven efforts. So the term that, there's no need to reinvent the wheel. And then it was important, what they highlighted in this report is that we build the science base. We need to build the science base behind oral health and prevention. So since that time, it's now 2023, what has happened? Well, we know that the population is aging. There are still a number of oral health disparities that are present. We know that the workforce is changing, but then we're also dealing with other issues such as mental illness and substance abuse. And then the cost of not just oral health care, the cost of health care is continuously rising. We're also dealing with emerging public health threats, but the good news is that we also have advances in research and technology. So given where we are, how would you grade the United States? How would you grade where we are in terms of oral health in America? Oral disorders are highly prevalent, not just in America, but worldwide. We know that untreated dental caries and permanent teeth is ranked number 1. We know that severe periodontitis is ranked 11th. 3.5 billion people are affected. And then oral disorders were 2% of the total YLDs for all ages in 2017. So YLD represents the equivalent of 1 full year of healthy life lost to disability or oral health. So what does the World Health Organization state to us? Again, we know that oral diseases are largely preventable. However, they do pose a major health burden for many countries. Again, 3.5 billion people are suffering from oral diseases. Again, untreated dental caries, the most common health condition. To me, that statistic, as often as I read it, still blows my mind. Something that is so easily treatable. It's complex, but easily treatable and preventable. It is the most common health condition in the world. We know that treatment for oral health conditions can be expensive, and unfortunately, it's not always part of universal health coverage. Most low and middle income countries don't have the sufficient services to be able to prevent and treat oral diseases. But we know that oral diseases are caused by a range of modifiable risk factors. So the things that we can control, things like sugar consumption, tobacco use, alcohol use, poor hygiene, and other underlying social and commercial determinants of health. Now, unfortunately, despite all of the advances in technology, the community health and promotion programs, there are still a number of barriers. And I put this information here because you need to be aware of your patient's barriers when you're designing any type of home care program. So number 1, there is fear. Sometimes people are afraid for whatever reason. It may not have been you, it may have been a previous experience. So just the sheer fear of maybe coming to an oral health care provider or even putting something in their mouth prevents them for taking oral health care seriously. A lot of people don't value oral health care. Again, oral health is seen as separate from whole body health. There are still problems with access, lack of education. This is where we come in, guys. Financial or insurance, the workforce. We know that COVID has kind of thrown the workforce into a whirlwind. There are shortages everywhere. Age is a barrier. There are cultural barriers. And then, of course, there are the socioeconomic barriers. So I know that's a lot of gloom and doom, but to me, this means we still have an opportunity. We have an opportunity to not only change the landscape of oral health care, but to also change the landscape of overall health care in America. One thing that we can do is that we can start increasing our own knowledge as oral health care professionals of the intricate links between oral and systemic health. Research and innovation are constantly revealing these associations and highlighting pathways for how we can help modernize home care for our patients that help them holistically. I love this quote, and I have it in a lot of my presentations. It says, medicine is embracing the potential for periodontal therapy to result in therapeutically meaningful reductions in markers of systemic inflammation. So it is no longer prudent for us to focus or limit our focus to just the mouth. When I say periodontal therapy, I'm really speaking of non-surgical periodontal therapy that not only includes what we do chairside, but it also includes what we're instructing our patients to do home, that oral health education. You can be the best clinician in the world, but if you do not take time to properly educate your patient or to educate yourself with other things surrounding the health of your patient, it doesn't matter how good you are. So let's talk about this oral systemic connection. We know that systemic conditions have a role in whole body inflammation. We know that chronic inflammation plays a central role in some of the most challenging diseases of our time, and some I have listed here. So the International Diabetes Federation, 537 million adults ages 20 to 79 years of age are living with diabetes. That means if you are routinely seeing 8 to 9 patients a day, 5 days a week, chances are you are seeing 2 to 3 patients who may be diabetic or pre-diabetic. So depending on what you're doing in your office, if you're doing A1C testing, you actually may be in the position to screen your patients for diabetes. The World Health Organization, they talk about cardiovascular diseases and how they are the leading cause of death globally. 17.9 million people died from cardiovascular diseases in 2019. So that's 32% of all global deaths. That means you're probably seeing someone with diabetes every day and then someone who presents with a cardiovascular disease. There are 1.28 billion adults ages 30 to 79 worldwide that have hypertension. This is, once again, an opportunity for you to help your patients. Are you screening for blood pressure each time your patients come in? The World Stroke Association, 6.5 million people die from stroke annually, 12.2 million new strokes each year. And 1 in 4 people over the age of 25 will have a stroke in their lifetime. Now, I know when I was growing up, I didn't associate stroke with anybody in their 20s, 30s, or 40s. That's no longer the case now. And then last but not least, 2.8 million adults die each year as a result of being overweight or obese. Overweightness and obesity are the 5th leading risk for global deaths. It's the statistics are really shocking. This is another quote that I like. Chronic inflammation is literally a stealth bomber, damaging your body just as deadly and silently as an invisible, odorless poison gas. You don't see it coming. It generally doesn't hurt. And by the time you realize it's there, it's too late. So what is the science telling us about this oral systemic link? There was an article in the Postgraduate Medical Journal, and it talked about the presence of periodontal pathogens in the arterial wall. As you see, number 1, Porphyromonas gingivalis, I'd like to call that job security, along with a number of other periodontal pathogens. They've been noted in the arterial wall. When it comes to hypertension, research is showing that systolic and diastolic pressure can be influenced by the bacterial load of periodontal pathogens. Elevated loads of specific periodontal pathogens increase systolic pressure by 9 points and increase diastolic pressure by 5 points. Okay, so there is a 3 times fold increased risk for hypertension when the following periodontal pathogens are present. And you see them listed here. So we can do, if you're only seeing your patients every 6 months, for some of you, it may be every year. It doesn't matter how well you can do chairside. You have to be able to create plans for your patient to be able to control these pathogens or the bacterial load when they're not in the chair with you. Diabetes and oral health. There has just been a wealth of information since the 1990s, establishing the bidirectional relationship between type 2 diabetes and oral health. There are new studies that are talking about type 3 diabetes, which is a connection between poorly controlled blood sugar and Alzheimer's disease. Then there's type 3 diabetes, that's diabetes of the brain, and that corresponds to a chronic insulin resistance, plus an insulin deficiency state that is largely confined to the brain. Then there's also studies that are talking about a type 4 diabetes. And so that's an emergence of an under-recognized form of diabetes linked to lean elderly individuals with the insulin resistance. So why is this important? When you can pinpoint the type of diabetes your patient may be suffering from, we know that the causes may be different, the treatment may be different, and how you instruct them to care for themselves and maybe the products that you recommend for them will actually give them a greater treatment outcome because it'll be more patient specific. Let's talk obesity. Let's get this to move here. Here we go. So obesity, we know that obesity, what is the science telling us? Obesity can alter periodontal microbial composition. And so in the presence of more adipose tissue, there's a more secretion of low levels of pro-inflammatory cytokines. So that's, it can alter the response of the host to the antigens that are derived from the bacterial plaque. We then get metabolic syndrome. So metabolic syndrome is a condition that includes a cluster of risk factors that are very specific for cardiovascular disease. So in order for someone to be diagnosed with metabolic syndrome, they have to have 3 of the following 5 risk factors. So too much fat at the waist, high blood pressure, something you can screen for, high triglyceride levels, low HDL, and then high fasting glucose. Let's talk about cancer. So there was a really well-written article in RDH magazine, and it talked about the effects of cancer treatment on periodontal condition and oral health. And this was a literature review. And based on the literature review, it was found that there was a correlation between inflammation-induced pathogens and cancer growth. Sleep medicine is relatively new. For those of you who know me, you may think that that is my English bulldog, Poppy. It is not, but Poppy, I can assure you, is significantly more handsome. And yes, I am biased. But let's talk about sleep medicine. Dental sleep medicine is the discipline that's concerned with the study of the oral and maxillofacial causes and consequences of sleep-related problems. What science is telling us is that poor sleep quality or poor quality of sleep was significantly associated with chronic periodontitis. So there, again, the science is there. We practice according to the evidence. Evidence is still coming our way, but the more that we understand these associations, we can better position ourselves to create more personalized, unique, and effective care plans for our patients. So in addition to making sure that we educate ourselves about these intricate oral systemic links, we also need to make sure that we're emphasizing the importance of working with medical professionals and for them to work with us. And we do this by establishing long-term partnerships with the patient and the medical doctor. We need to be able to speak with one another. One thing I love about electronic health records, a meaningful use was something that came out a long time ago, and hopefully the medical dental integration portion of that is better, is that now it makes it easier for the dentist to speak with the medical doctor. So they may be able to speak real time with the internist or with the cardiologist or the pulmonologist. Medical dental integration is going to be key. What does the science tell us about this medical dental integration? The bidirectional relationship among oral health and other diseases and conditions provides a strong rationale for that bidirectional relationship between oral health care and primary care. And so there are many different ways for us to integrate. Again, there's interprofessional education. I would love to see more dental events where we have people from other health professions that are speaking to us. And I would love to see other healthcare conferences that are not inviting just dentists, but dental hygienists as well. There's that interprofessional collaborative practice. So in many states, dental hygienists are now able to work in pediatric practices. They're able to work alongside oncologists and cardiologists. There's that closed loop referral process. And then, of course, we have access to various public and private partnerships. We know that there are lots of barriers in integration, but of course, we need to start somewhere. Now, why is this medical dental integration so important? There are a lot of common risk factors. So the common risk factor approach, it's a method used to create a cross-disciplinary health promotion program that shares common risk factors for disease. So what we find, or what researchers is finding, is that many of the behavioral risk factors negatively impacting oral health also have detrimental effects on overall health. And we just talked about that. We know that poor diet, leads to poor systemic health and poor oral health. Stress, poor oral hygiene, lack of exercise. Let's go to tobacco consumption and alcohol consumption. So, systemic diseases and oral diseases are sharing these risk factors, again, highlighting the importance of this medical dental integration. Researchers are advocating an integrated approach to healthcare as emphasized in recent reports from the FDI and the ADA, along with the Surgeon General. So you may be saying, how do I begin? How can you start the transition from where you are now? If you're already doing this, wonderful. But if you're not, how do you start this transition? How do you take a more modern approach by incorporating the statistics and incorporating the, increased knowledge from the oral systemic link and understanding the barriers? So the easiest way and the smartest way to begin this transition is to first understand that you have to acknowledge what your patient's risk is. And you can do this through a P4 model. What do I mean by P4? So another quote here: with the overdue recognition that the mouth is connected to the rest of the body, healthcare is starting to recognize that oral diseases have an impact on systemic health. So the P4 model, this is a medical model of management of healthcare. The 4 Ps represent an integrative approach and proactive approach to healthcare. So the 4 Ps incorporate being predictive, preventive, personalized, and participatory. So predictive, that means that you are preparing for a problem before there is a problem. So identifying those illnesses before symptoms develop. So you're using knowledge about a person's current health to predict their future health. The second P, preventive, then allows the healthcare team to recognize early signs of disease to avoid serious illnesses. So in this stage, you would want that person to enjoy health versus managing chronic illness. So you have the tools that you need to prevent potential problems before there is a problem. With the personalized section here, this is where you're coming up with a custom-made health management plan. These are personalized treatments that should primarily focus on wellness. So the key here is focusing on staying healthy instead of trying to get better. What I love about the personalized section is that it eliminates the one-size-fits-all approach to treatment. It also eliminates the one-size-fits-all approach to developing a modernized custom home care plan. The last P is participatory, and this means that the patient is responsible for directing their own healthcare. Decisions are made based on the conditions, risk, and options to control conditions. So here, this is where the oral health education really has to kick in, because at this point, the patient is becoming fully a part of their own healthcare team with decision-making abilities. What we know is that if disease can be accurately predicted at the patient level, we can then have targeted interventions to prevent the disease from occurring. That becomes possible rather than reactively treating its manifestations. So risk. This is where we really need to step it up. We really need to spend more time with the patient. Estimating an individual's risk is essential because the outcomes affect treatment and prognosis at the individual level. So when we talk about modernizing home care and a pathway to prevention, it's not just about saying, here's a toothbrush, I recommend a different toothpaste, and oh, by the way, use a water flosser, and that's it. You really have to consider so many other things, risk being that one thing. And there are different risk factors that you need to consider. So there are patient level risk factors. A lot of these risk factors are collected through a thorough, comprehensive medical history. I don't think that we spend enough time as clinicians really collecting and going through with our patients their medical history. On this medical history, we find patient level risk factors such as smoking, alcohol consumption, stress, nutrition, whether they have diabetes, what their family history is. We know about gender and age. In addition to these patient level risk factors, we have to consider what are their oral risk factors, things such as their hygiene status. Is it poor oral hygiene? How much plaque or calculus they have, stage and grade for the periodontium, what's the severity of it? if they're using fluoride. And then you have tooth-related risk factors that need to be considered. Is there bleeding on probing? Is there any malalignment of the teeth? Are there any restorative overhangs? Is there furcation involvement, mobility? Is there anything impacting crown margins? So when you are modernizing your home care, you absolutely must consider risk. Again, understanding the statistics, I'm going to keep saying it, educating yourself about the oral systemic link, adopting a medical model of disease management using P4 so that you can predict and help prevent is the pathway to modernizing your home care. Oral and systemic diseases can be prevented with simple lifestyle changes such as diet and exercise. The dental hygiene appointment, specifically the dental hygiene appointment, offers an opportunity to discuss the relationship amongst the patient's oral conditions, findings on the medical history, and other information provided. In order for home care to be effective, we need for our patients to be compliant. And here is where education becomes key. Patients must understand that they absolutely hold the key to a healthy lifestyle. We have to get our patients to change their behavior and then create value. When patients realize how important it is to participate in their oral health, they will contribute to improving their overall health. You no longer have to try to sell it because they now value it. So when we talk to our patients, when we have that oral health education session, that talk should be focused around health literacy. And that is, our patients need to understand the information that they are given, and in addition to that, we need to make it less complex. Some things we don't have control, like we don't have control over the entire healthcare system. But the things that we do have control over, we really need to make it less complex for our patients. As dental health professionals, specifically dental hygienists, we help our patients become healthy or health literate through education and promotion. And so what does health education and promotion do? It helps us to provide effective dental health education. Again, back to changing values aimed at improving health. The reason why some of you are constantly saying, floss, 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 you're not flossing, you're not flossing, you're not flossing, is because we have not been in the position to change the values within our patients aimed at improving health. Health education and promotion is designed with implementing healthy behaviors and then eventually forming habits. What are some of the things that you can do? Again, these detailed oral hygiene instructions. We want to help our patients reduce inflammation, right? We don't want them to have those inflammation-causing pathogens in the oral cavity. What are your patients going to do when they're not with you? Maintenance visits every 3 to 4 months. The insurance company is dictating every 6 months, and there are certainly some patients out there that can get by with a 6-month appointment. But I would say in even some instances, you may need to see your patient every 2 months if necessary. Application of a fluoride varnish at each visit. If it's not in the office, what type of fluoride therapy are you recommending for your patients at home? Saliva substitutes to patients with xerostomia. So we talked about this oral systemic link and how sick people are. Well, most of these people are on a medication. And with every new medication introduced, patients have a greater chance of developing xerostomia. And with xerostomia, there's an increased risk of caries, halitosis, periodontal disease. So we definitely want to recommend saliva substitutes and other products when necessary. When we are recommending mouth rinses and dentifrices, we want to make sure that, let's just say if someone's suffering from xerostomia, that they consider avoiding alcohol-containing mouth rinses. And then, of course, there's that diet. I know that can be very uncomfortable. And look, guys, I get it. I know that some of you only have 45 minutes. I've been there. Some people only have an hour. So I'm not asking you to do this every single visit, every single time. But there's an opportunity to kind of plan this out so that at least at some point you're having the conversation about diet. At some point, you're having a conversation about, home care. At some point, you're doing a check. This was something written by Susan Wingrove, and it was in the American College of Prosthodontists guidelines for recall maintenance patients with tooth and implant-borne resorption. So this was geared towards patients with implants, but I think it can really apply to anyone. And it really focused on the home care regimen, where the recommendation is to include a powered toothbrush, a water flosser, and a mouth rinse. Again, she talks about the importance of routine maintenance intervals, 2 to 6 months, but at the bottom, and this is why I included this, patient education is where it all begins. When you're talking with your patient and you are developing that home care plan, that's where it begins. So getting started. Communication. Communication is key. I know going through hygiene school, I would think, why in the world do I need a communications class? And why do I need a psychology class? And why do I need to take sociology? It all is making so much sense now. So effective communication is going to be key. With effective communication comes effective questioning. So as dental professionals, dental hygienists, we must master this skill in order to get the information from the patient that we want and need. When we are using effective questioning skills, we are using language that the patient understands. We are asking one question at a time. We avoid leading questions. We avoid interrupting the patient. And it's important to note that when we ask questions, we need to do so in a positive way. Part of effective communication means that we have to explain. So many clinicians, especially novice clinicians, forget to explain procedures because they are so focused on the clinical aspects of treatment. When we explain to our patients, they become more knowledgeable. This is an opportunity for us to create value so that we can get the resultant behavior change. Patients want to know. Patients want to know. So give the information. Tell them specifically why the treatment is being done. Don't be afraid to tell your patients they have an infection, they have a disease. Explain the procedure in its entirety. Think back to when you first start treating children. It is recommended that you explain every single thing that you're doing. That's what you should be doing for your adult patients using the appropriate language. You always want to make sure that you're seeking patient cooperation, saying things like, can you please, and offering them encouragement. With effective communication, you should definitely make meaning of your words, make sure that your words are understandable. If there's a language or a speech barrier, use technology. There may be an interpreter. And then last but not least, you want to give feedback. Let them know if their procedure went as planned, if it did not go as planned, what you expect the outcome to be, what you expect for them to do. Remember, there is no one size fits all for oral health care education. It is based on the individual's needs, their existing dental disease, their risk, we've talked about that, their risk for dental disease, their abilities, their limitation, and this is key, their willingness to perform the task at hand. And I'm jumping ahead a little bit, but I'm going to say this. It is the patient's willingness to perform the task at hand. If you are developing a personalized oral home care plan, and throughout the visit, your patient has said, I hate flossing, please do not pull out a piece of string floss because there are so many other options for interdental care. So developing that plan, what are some of the things that you should consider? Again, the current oral health status. Do they have gingivitis, periodontitis? Do they have caries disease? Do they have other health issues? There's that R word again, risk, right? You also want to consider what the patient's hot button is, or what is their reason for motivation to change. And it could be different. Some people may say, I just want to be healthy. Some people may say, I just want white teeth. Some people may say, I just don't want bad breath. But you have to figure out what that hot button is, because that hot button is going to be what motivates that patient to change. And then you need to consider the patient's dental IQ or their current understanding of oral health conditions and the consequences. They may understand the condition, but I don't think we spend enough time explaining the consequences, right? And when we're explaining the consequences, it shouldn't always be, if you don't brush your teeth, they're going to fall out. Well, there are some things that happen in between that time, right? So again, communication skills are going to be critical for your effective oral health education. Sometimes using nonverbal communication techniques would help. Active listening, and of course the dialogue. It should never be that you're just talking, because if you remember P4, participatory, the patient has to be an active and willing participant in their care. So in developing the oral health education plan, it is our job to help increase our patients' resistance, especially for those that are suffering with dental disease. What we send them home with is going to be good, but sometimes we need to go home with them, if you know what I mean. Once our patient leaves chairside, it would be nice if we could provide them with tools and solutions that are working, like it's like they've taken their dental professional home with them, so that, you know, they're being protected in between that 3, 4, or 6 month visit. So one way you can do that is through in-office fluoride therapy. We don't use it enough. We know that fluoride is very, very effective. Fluoride varnish. I don't use foam anymore. Foam, what the research is telling us is that it is not as effective as we once thought. So definitely using a fluoride varnish. I don't know too many adults who are going to sit with a foam tray in their mouth. We know that varnish holds concentrated fluoride doses close to the tooth surface for longer periods of time, for up to 7 days. Varnish can be 50 to 70% more effective in preventing dental caries in both children and adults. When you're considering a fluoride varnish, you need to, once again, understand what are your patient's problems and what do you want the varnish to do? What do you want the product to do? So I have 2 products here. One actually has an extended release of the fluoride that's within it over time, and that would be your Pulpton Embrace varnish. And then you have the Pro Fluoride varnish by Voco. That, there's an immediate release of fluoride. So depending on what condition your patient presents it with, you may say, hey, I need for this oral cavity to be flooded with the fluoride, right? Or you may say, I need for my patient to have an extended release of fluoride over time. There are several people who may be allergic to the stickiness in the varnish or the colophony, and some adults just don't like the feeling at all. So there are liquid fluoride varnishes. So let's just say you have a patient that may be have had caries, but they also may be suffering from dental hypersensitivity. I believe in using products where, and I'll use this term, you can kill 2 birds with 1 stone. And then sealants. The ADA did a nice write-up on sealants, and they talk about how sealants are highly underutilized. Yes, there are some adults that present that actually could benefit from the use of sealants, and we should definitely consider that. In addition to sealants, glass ionomers. So glass ionomers, some people prefer the use of glass ionomers. They're not always as durable as your resin-based sealants, but very effective. Excellent fluoride release. And what I really love about glass ionomers is that it has excellent biocompatibility. So we know that our teeth move, we can't feel them. And what you find with some of the glass ionomers is that ionomer will move. And then last but not least, silver diamine fluoride. I could talk about silver diamine fluoride all day. But these are, again, fluoride therapy, so many different options that you can consider. A lot of the sealants have fluoride in them as well. Glass ionomers, they have fluoride in it, but consider that fluoride therapy. Nutritional counseling. That is a part of an effective and modern home care plan. I don't ever remember my dentist talking to me about my diet. Maybe, oh, Joy, you've gotten a little big, that freshman 15 after you've come home from college, but never in relation to my oral health care. So again, this is not something that you may be able to do every time. I've often said this since I've been practicing, and I'm going to age myself. I graduated hygiene school in 1997. I know of one hygienist that consistently offered nutritional counseling to her patient. So just some simple counseling tips. You want to select a space in the office that creates a casual and relaxed atmosphere. Whenever you have plastic examples as food or measuring cups, that helps to conceptualize. I have a problem with conceptualization. So if someone says, yeah, the room is 16 by 9, that doesn't mean anything to me. So I need hard, fast examples, suggesting modifications that are necessary. And counseling is certainly more in-depth than this. I'm going very surface with this, using laminated pictures and then providing the patients with brochures. The beautiful thing about technology now is that there's so much online. There's so many apps, so many things that you can pull up chairside if you have a computer to really assist your patients and maybe speed up this process when necessary. So improving oral hygiene. How do you help your patient improve oral hygiene? How do you help them with their home care plan? And there are some things that you certainly need to consider. Now, I talked earlier about how some studies recommend electric toothbrushes, but some manual brushes can still be very effective. And then you have to think about patients that have sensory issues. Electric toothbrushes are just not always going to be suitable for everyone, no matter how much we want them to be. So if we're recommending manual toothbrushes, or if your office and you're still giving out manual toothbrushes, chances are you probably order 300 toothbrushes a month and everybody gets the same toothbrush. That's not creating a personalized care plan, and you're actually not doing the best by your patient. So when you're considering a manual brush, you need to consider what your patient's preference is. Look at the design features. Toothbrushes look different for a reason, because they're designed to do different things. They're designed to work better on certain anatomy. You need to consider the toothbrushing method prescribed. You probably don't remember that. That was way back when you first started clinic, but there are different toothbrushing methods. And based on what your patient's needs are, you need to prescribe a method specific for them. You need to consider your patient's intraoral characteristics. So if you have a man with a really, really large mouth and you have a really petite child, chances are their toothbrush should be a very different size. You don't want to give that child a really, really large toothbrush, and you don't want to give that man a really, really small toothbrush. They may not be as effective as they should be. Consider your patient's motivation, but also their manual dexterity. That's key. We can't forget about those things. And then cost. Back when I taught, this was an exercise that was already in place when I took over the class, but the students were required to go to different stores and price out the cost of a toothbrush. I unfortunately had to buy a toothbrush once traveling and could not believe that the cost of what I consider to be a decent toothbrush is $7. Now, for some of us that aren't living paycheck to paycheck, that may not seem like a lot of money, but for someone who's on a fixed income, and $7 means the difference between buying the toothbrush you recommended or the medication that they have. Maybe you need to keep in mind that there are some alternatives that they can use. So again, if you know that your patient is really struggling, living paycheck to paycheck, and they don't have a lot, then really be mindful of the things that you recommend, because there are options. Power toothbrushes, we know that they're a great alternative to manual brushes. They can be 30% more effective in biofilm removal, but the same considerations that you have for a manual brush are the same that you need to keep for the electric brush. This here talks about the long-term impact. This was a study. It was the long-term impact of powered toothbrushes on oral health. This was done over 11 years. And based on the study, it stated that it seems that the powered toothbrush in the long run helped in maintaining the number of teeth in the oral cavity, reducing the progression of periodontal disease burden. Consider different brushing aids. This brushing aid is called a mouth mate. I learned about this last year. When we are instructing our patients to brush, it can be really difficult for some patients. For those of you who disclose, and I highly encourage you to do that when creating a customized care plan, there are going to be certain areas that you find that patients are constantly missing. With the use of a mouth mate, it actually helps to provide easier access and visibility to your patients when they are brushing. So what you find with this mouth mate, it's really a retraction device. You're improving access to molars in hard to reach areas. So this is what that mouth mate would look like. I believe there are several videos on YouTube that you can look at to see how this works. But again, this would be something very customized for your patients. And it's really a modern way of how, teaching your patients how to care for themselves at home. Interdental care. Notice I did not say flossing. Interdental care. You have to consider different things, the presence or absence of interdental papilla. How are the teeth aligned? What are the shape of the teeth? What's the contour of the tissue? Does the patient have restorations, and what are the conditions of those restorations? How tight are the contact areas, right? What's the patient motivation? How effective is the patient going to be? So I'm going to go back to the really large man. If you have a really large man with really, really large hands, sometimes those really, really large hands can't even get into the back of their own mouth. So string floss would not be an option. And then, of course, you need to consider the size of the gingival embrasure. So you have several interdental tools that can be used based on your patient's motivation, how easily they can use it, cost. You definitely want to select something or recommend something that works specifically for them. Water flossing. I still love my string floss. I know what I'm doing, but I'm a huge advocate of a water flosser. I have been using one consistently since about 2015, 2016. And even after I floss, I'll go back with my water flosser and I am shocked at what comes out of my mouth. Water flossing, again, is the technology. There are different brands out there, but understand that there is a wealth of research out there supporting the use of water flossing. So I just want you to take a moment and ask yourself this. How much time are you really spending creating oral health education protocols or guidelines for your patient? How much time are you spending with oral health education in general with your patient? Because that is the most important part of the dental hygiene appointment. What are you recommending? Do you even have product knowledge? I will be completely transparent. Very early on in my career, I just simply gave my patients what was in the office, not having a clue as to what the product really did. Oh, I just knew that it may have helped with caries or it may have helped with dental hypersensitivity, but I truly did not understand the mechanism of action. So do you have product knowledge? Are you performing a skills check? So you've seen your patient today, they come back and see you in 3 months. Are you even going to perform a skills check? And if you've performed the skills check, are you giving your patient input? Right? If you're doing a plaque index and let's just say they're at 52% and they come back, they're at 26%, are you saying good job? And it don't just say, oh, you're still at 26%, you should be at 10%. Are you saying good job? You've gone from 50 something percent to 26%. That's a great job. Let's disclose again and see what else we can do better. A lot of times we're going to recommend over-the-counter treatments. And so what I say to that is when you are recommending a dentifrice or mouth rinse, make sure you're educating your patient on how to use those products in order to achieve the desired result. These products require your patients to be compliant. This is why I say it's sometimes great to take your patients home, for your patients to take you home with them, because a lot of our patients aren't going to be compliant. So you have to have solid product knowledge. You need to know what that product is doing before recommending to a patient who may not be compliant. Let's just say a patient is experiencing dental hypersensitivity. Patients usually can expect to receive some sort of relief within 2 to 4 weeks, but chances are they're going to give up within the first week. And in order for certain products like that to be effective, they have to be used consistently. It is also worth noting that with some of the products that you're likely going to recommend to your patients that are over the counter, they should be cautioned to use a minimal amount of water. If they use an extreme amount of water, they may inadvertently dilute the active agent. So things that we typically would recommend for our patients over the counter are toothpaste, Oh my gosh, there's so many different toothpaste on the market, and your patients are going to get overwhelmed. Can you just imagine if you weren't in the dental profession and you went to an oral health care aisle and there are 50 different brands of toothpaste? How would you select? This is where you, as the expert, you, as the healthcare provider, you should be guiding your patient. There should never be a moment where your patient is just walking down the aisle confused about what he or she should be getting. So again, depending on what your patient's needs are, do you want the toothpaste to have fluoride in it? Do you want it to have another active ingredient in it? Flavor typically is a personal preference. We do have patients that don't want fluoride. There are several options there. So again, you want to make sure that you are being the expert for your patient. Creams, paste, or gel. So some of these things you can give to your patients in office. Other things are based on a subscription program. They can order for themselves. I say creams, paste, or gel. Creams are typically used differently from paste. So here, Remin Pro, that's a tooth cream. It's a tooth cream that contains nanohydroxyapatite, and it actually, again, I'm going to use the term, it's designed to kill three birds with one stone. Why? Because it has the nanohydroxyapatite in it. It also has a fluoride in it, and also has xylitol in it. So let's just say your patient is suffering from dental hypersensitivity, dry mouth, and they're prone to caries. This product actually has 3 different products in it. You have the MI paste. So it does say MI paste. This actually has stannous fluoride in it. This is something relatively new. It's designed to clean and treat, but this is one where you actually need to read, because it'll say, yes, the patient should use a pea-sized amount, brush for 2 minutes, but then it also says that the patient should not rinse their mouth out. And then you have patients that are looking for a more natural option. And this is where we have the tooth and gum line. I'm going to talk about them in the next few slides. But patients are definitely looking for that all natural route. They don't want things with fluoride in it. They don't want things with sodium lauryl sulfate in it. And so this is where you have to have extensive product knowledge to be able to recommend more natural ingredients. You have mouth rinses. We know that mouth rinses can be very effective. There are some common agents out on the market. Mouth rinses should definitely be incorporated. Now, depending on what your patient's needs are, you have molecular iodine. So that is gaining a lot of traction. We know that the use of molecular iodine can be really, really good for fighting a lot of oral diseases. They can be used in subgingival irrigation in terms of like your water flosser. But again, there's a wealth of research that speaks to the efficacy of this molecular iodine. So I highly recommend that. And then you have other rinses as well. Again, people are looking for all natural and alcohol free. So this tooth and gum tonic from Dental Herb Company, I actually started using this, guys, in 2004. So I'm speaking from personal experience. So why do I love this? Why did I recommend this to my patient? Again, it certainly helped with inflammation. I typically recommended it at the time for my patients shortly after they had scaling and root planing procedures, and it was excellent for people who had bad breath. So again, all natural, uses essential oils, herbal extracts, and it is highly, highly effective. This line, so sometimes, let's just say your patient needs a rinse, and they may need a subsequent gel, and they need a paste. So this line has rinse gel paste, and if you need an arrogant for your water flosser, they have that as well. So definitely different things for you to consider. So this is a list of some of the all natural ingredients. And I often say to people, what did we do 100 years ago? What were some of the things that we used 100 years ago? Again, I still advocate for fluoride, but we just need to know that there are some more options for our patients, more natural options for our patients that can work equally as well. So I urge you to consider those things. Mobile technology. So we're talking about modernizing home care. So the World Health Organization came up with mobile technologies for oral health and implementation guide. And this actually provides a comprehensive instruction guide on how to complement existing oral health initiatives. and oral health system responses through mobile technologies. Be Healthy, Be Mobile program is what it's called. It was developed in 2012, but I can get even more simple than that. If you look at some of the powered toothbrushes, I believe Oral-B, Philips Sonicare, they actually have mobile apps designed to help guide you, to tell you where you need to spend more time and things of that nature. So use the technology to your benefit. And then you have some people that are using virtual reality. So they're creating simulators that help improve skills. So they simulate a virtual patient with a specific clinical condition so that they can train the person on how to intervene. Wonderful, wonderful technology. So we are nearing our time. So we talked about a lot. We talked about the connection between oral health and general health. We talked about the P4 model, described some emerging trends and products, and talked about how you can develop your evidence-based personalized oral home care program for your patient. Now, there are some products that I mentioned on here that you may want to get access to. I love Lunch and Learns, and I love free product samples. So if you want to know more about the Dental Herb Company and their products, these were the all natural products. I encourage you to scan this QR code here. You are going to be able to get free product samples sent to you. So I encourage you to scan this. In addition, I love Lunch and Learns. Voco, they definitely offer Lunch and Learns. So you want to scan the code to find out where your Voco representative is. While I was in the school, I had them come to my school twice a year for every cohort to come in and talk to the students. What you will find when you do these Lunch and Learns, you really get to ask the questions, but you really learn how the product works. So you're able to decide who you want to send that product, who you want to give that product to or not. And then, of course, water flossing. There are Lunch and Learns for that. A lot of companies do Lunch and Learns. These are the two companies, Voco and Waterpik, and then of course the product samples from Dental Herb Company. So I want to thank you so much for joining me, and I will take this opportunity to answer any questions anyone will have. Let's see here. Question. Can I get the QR code for tooth and gum again? So I do believe this is going to be on demand. I no longer have control of my screen, but what you can do is send me an email and I will be more than happy to email the code to you directly so that you don't have to wait. And I think that is it. I don't see any more questions. Oh, here we my patient insists on oil pulling with coconut oil. What do you think? There's just, in my opinion, that's not something that I advocate for. So there have been several situations, even practices, multi-practitioner practices where one dentist advocated for it and the others did not. That's just not something that I specifically recommend, but that's just my personal opinion. Let's see. Thank you. Is tooth and gum available at Walmart? Great question. So I am going to say Google it and see what are some of my favorite dry mouth products. So again, the Remem Pro works really, really well. I suffer from dry mouth. I travel with it, but I keep it on my nightstand, but also Elevate Oral Care has a line of dry mouth products that works really well too. Let's see. What brand of water flosser do you recommend? You have lots of good water flossers out there. I have only ever personally used Waterpik. I've had mine for about 5 years. I've used the traditional one with no problem. But again, there are others out there that work equally as well. I was told by a dental hygienist friend that Sensodyne toothpaste has something that causes Alzheimer's. I am not aware of that, but now you're going to make me do some research. I thought I was going to go kick my feet up, but I'm equally as curious. I have not heard that, but I'm certainly going to research that. And thank you for asking that question. It's a good one. Do you recommend any product for the periodontal disease characteristic halitosis that stays even after perio treatment? The mouth rinse that I talked about from the Dental Herb Company, you would be surprised again, I've been using that since 2004, and it works really, really well. Okay, where do you get the molecular iodine? I think that was the question. Where do I get the molecular iodine? So the molecular iodine, if you go to their website, you can find out information. They will actually schedule a call with your office and give you the information that you need. And I'm going to pull up that specific. It is called IO rinse. So if you Google IO rinse, you will be able to get more information on the molecular iodine, and likely you will get some samples as well. Let's see. What are my thoughts on charcoal toothpaste? Many patients have asked about this. I'm not a fan. I'm just not a fan, and I'll leave it at that. What about hydroxyapatite for cavity prevention and sensitivity? Absolutely. Again, that nanohydroxyapatite is in that Remin Pro cream, and I'm a huge advocate for it. I first started using the Remin Pro because I had white spots and sensitivity as a result of whitening. So again, I am speaking from personal experience, and it just happened to help with my dry mouth. I hear over-the-counter mouth rinses can increase the risk for patients to develop high blood pressure if certain patients have sensitivities. I haven't heard anything specific to that. Maybe, and I'm not saying that this is true, maybe it has something to do with alcohol content. So maybe going with something a little bit more natural would help. What mouth rinses do you suggest to a patient with a implant? The Dental Herb Company, the molecular iodine would work as well. How does the hydroxyapatite work? So our teeth are made up of a natural substance. So, with nanohydroxyapatite, that is the natural composition of our teeth. So nanohydroxyapatite, they're like nanoparticles that actually fill in the superficial lesions on top of our tooth surface. So it creates an impenetrable surface. So it recreates our natural tooth surface, and that's how that works. Let's see, I think I have gotten to all of the questions. So thank you guys so much. We have finished right on time. It's been a pleasure, and I look forward to perhaps seeing you again at another webinar. Have a wonderful afternoon or evening.